A warm welcome to everybody. I am Dr. P. Vinod Kumar, Associate Professor of Forensic Medicine, Sree Balaji Medical College and Hospital, and Bharat Institute of Higher Education and Research, Krompet, Chennai. Today I am going to talk about mercy killing or euthanasia. The specific learning objectives of the session are to define and describe euthanasia and its types, the arguments for and against euthanasia, the legal and ethical issues involved, and what is the role of doctor, specifically psychiatrist and psychologist, in euthanasia. The term euthanasia is derived from the Greek word eu and thanatos, which means good death or easy death. It is also known as mercy killing. The ancient Greeks viewed illness as a bothersome affliction and allowed sick individuals to seek the approval of the state to commit suicide. Euthanasia refers to the intentional termination of a person's life, usually, but not always at the person's request, and usually in the context of terminal illness and or incurable suffering. This is according to the Australian Psychological Society. While most Greek philosophers supported euthanasia, to Aristotle, suicide was an offense against the state. In 1516, for instance, Sir Thomas More wrote Utopia, in which patients living in an ideal society were encouraged to commit suicide if they were suffering from a terminal illness or experiencing unrelenting pain. Hippocratic Oath, which was written between 400 and 300 BC, the oath states, "To please no one will, I prescribe a deadly drug or give advice which may cause his death." According to him, a doctor is to relieve the pain of his patient in one hand and protect to prolong his life on the other hand. In 1930s and the early 1940s, the Nazis' adoption of the word euthanasia was to describe its mass extermination program. In Germany, euthanasia was employed to murder over 1 lakh people, and all the killings were committed without the patient's consent and generally without the patient being aware of the impending act, according to the General Assembly of the World Medical Association. Now, what are the types of euthanasia? So, euthanasia can be active or positive, passive or negative. So, active euthanasia is an act of commission. It means a positive, merciful act to end useless sufferings and meaningless existence. For example, by giving large doses of a drug to hasten death. Passive or negative, it is an act of omission. It means discontinuing or not using extraordinary life-sustaining measures to prolong life. For example, discontinuing a feeding tube or not carrying out a life-extending operation or not giving life-extending drugs, etc. Voluntary euthanasia. Euthanasia practiced with the express desire and consent of the person concerned. Involuntary. Euthanasia practiced against the will of the person. Non-voluntary. Euthanasia practiced in persons who are incapable of making their wishes known. For example, in persons with irreversible coma or severely defective infants. Physician-assisted suicide or PAS. So according to Murky PN and Singh KS, in the Journal of Indian Academy of Forensic Medicine and Toxicology, they wrote, "Doctor provides an individual with information, guidance and means to take his or her own life with the intention that they will be used for this purpose." Dr. Death. Jack Kevorkian was a US-based physician who assisted in more than 150 patient suicides. Infamous in 1990 when he assisted in the suicide of Janet Atkins, a 45-year-old Alzheimer's patient from Michigan. Kevorkian agreed to assist her in a public park inside his Volkswagen van. Kevorkian attached the IV line and Atkins administered her own painkiller and then the poison. The state of Michigan immediately charged Kevorkian with Atkins' murder. On March 26, 1999, a jury in Oakland County convicted Jack Kevorkian of second-degree murder, illegal delivery of a controlled substance, and was sentenced to 25 years in prison. In 2010, HBO announced that a film about Kevorkian's life called You Don't Know Jack, featuring a film legend Al Pacino as Kevorkian. He died on June 3, 2011 at the age of 83. Now, what are the arguments in favor of euthanasia? Ethical and moral, that is to respect sufferers' autonomy. This argument rests on the ideal of being able to at all times to exercise as much control over one's life as is possible, to allow individuals to value quality of life over sanctity of life, and to end suffering, which can be miserable. To reduce reliance on life support systems or advanced medical knowledge, to reduce the risk of premature suicides, to reduce the legal jeopardy of those who implement euthanasia, and the changes in professional and public attitudes to euthanasia. Now, what are the arguments against euthanasia? Again, ethical and moral issues. So there's absolute respect for human life. God has given us human life, and no human can take another human life. The possibility of coercion, loss of autonomy, poor decision making by the sufferer. When the sufferer is suffering from a terminal illness, he is unable to take a rational decision. Conflicts of interest, difficulty of enforcement and monitoring, reduction of efforts in diagnosis, treatment and care because of the terminal illness, inadequacy of modern medical and palliative care. Trends of euthanasia in different countries. The Canadian law allows a person to refuse medical treatment and the medical profession accepts the living will. But the law does not allow the doctor to actively help someone to kill himself. However, amidst the ongoing debates, Netherlands became the first testing ground for the world since it legalized euthanasia on 28 November 2000. Australia also has a voluntary euthanasia law, which is statedly working well. In Australia, a computerized injection system is in use to accomplish euthanasia. The euthanasia law was adopted in 2001 in Belgium. This law defines conditions for doctors to avoid penal punishment. Physician-assisted suicide is legitimized in Switzerland. Currently in the UK, any person found to be assisting suicide is breaking the law and can be convicted of assisting suicide or attempting to do so. Although 2/3 of Britons think it should be legal, a recent assisted dying for the terminally ill bill was turned down in the lower political chamber, the House of Commons. In USA, the practice of euthanasia is a clear offense too, theoretically, but in real practice, the judgments of different courts during trial of euthanasia cases seem to be liberal. Physician-assisted suicide is legal in Oregon and Washington state in the US. In India, like almost all other countries, euthanasia has no legal status. The practice of euthanasia is a clear act of offense, either a suicide, an assistance to commit suicide, or a murder. The latest judgment of Supreme Court declares that right to die is not included in the right to life under Article 21 of Indian Constitution. So what our Constitution says? Article 21 is a provision guaranteeing protection of life and personal liberty, and by no stretch of imagination can imply extinction of life. Right to life is a natural right embodied in Article 21 of the Constitution, but suicide is an unnatural termination or extinction of life, and therefore not compatible and inconsistent with the concept of right to life. So this is Arnold Schönborg. We'll see the Arnold Schönborg case. In 27 November 1973, Aruna Ramchandra Schönborg, a nurse aged 24 working at KM Hospital, Mumbai, was attacked by Sohan Lal, a sweeper working in the same hospital. Assaulted in the basement, strangulated with a dog chain, resulting in cervical injury and brainstem contusion due to lack of adequate oxygen. Based on assessment since 1982, Pinky Virani, a national award-winning journalist, social activist, filed a petition criminal petition number 105 of 2009 in Supreme Court of India for mercy killing on behalf of Aruna under Article 32 of Constitution of India. She pleaded Supreme Court to have Aruna stopped being fed and let her die peacefully. On 24 January 2011, the Supreme Court of India responded by setting up a medical panel to examine her. However, it turned down the mercy killing petition on 7 March 2011, but legalized passive euthanasia. Schonberg died of pneumonia on 18 May 2015 after being in a persistent vegetative state for nearly 42 years. So this is a landmark judgment in euthanasia as concerned our country. Now, what is the role of doctor, a psychiatrist or psychologist? The first and foremost is the assessment of the patient, whether he really needs euthanasia, whether active or passive form or not. Treatment, counseling of the patient as appropriate. An advocacy role for the patient or relatives and carers. Educating decision makers, clinical staff, patients and the public in the psychological aspects of euthanasia and what psychologists can offer in that area. Facilitating others' professional development in that area too. Conducting research in the area and disseminating knowledge. The decision-making process raises many difficult psychological issues. It is clearly apparent that every case where a patient requests assistance to die should be assessed individually. Policymakers should consider these issues seriously and to bring them to the attention of other professionals and policymakers. These are my references. Thank you. To summarize, euthanasia or mercy killing is the termination of a patient's life suffering from incurable illness or terminal illness like cancer. However, the decision for euthanasia should be taken according to the law of the land. In India, according to our constitution, Article 21 says every person has a right to live or right to life, and no human can take a life of other human. And only passive euthanasia is legalized in our country. That is an act of omission by removing the life support or refusing to intubate in case of terminal illness. However, the decision of euthanasia should be taken after counseling the patient, consulting the relatives, and also getting counseling by the psychologist. Thank you.